Well, thank you very much for the invitation to come and speak to you. So I think this is quite a nice, friendly subject about patients and what they think about time-lapse and what is the impact of time-lapse for them. So I'm going to talk to you about our approach, where I work in the UK, and the information that we give to patients, the questions that we ask the patients, and how we measure the responses and how we learn from their feedback, really. And then I'm going to go on to talk about what is the actual impact of time-lapse for them. Does it really affect the results? And I've got a little bit of data to show you and talk about our models. So this is a map of the UK and Ireland over here. So we've got a group of clinics and satellite clinics. We've got 7 laboratories, each have time-lapse established within them, and a few satellite clinics that feed into them. So currently about 30–35% of our treatment cycles use time-lapse. In all of those 7 labs we have embryoscopes, but in one of them in Sheffield we have also Prima Vision, and we're currently evaluating the MIRI time-lapse, which is relatively new. So we've designed these bespoke stacking frames so we can house 2 embryoscopes at a time. And across these 7 laboratories we standardise practice, so we can combine our data and our experiences. We use the same culture medium, we use the same annotation practice, so we're all recording the same thing in the same way. So we think that gives us a lot of power to develop algorithms in which we can use to select the best embryos. So far, we're changing every day. We've done about 6,000 cycles in our embryoscopes. We estimate around 60,000 annotated embryos. We annotate every 2 PN embryo. We've had well over 1,000 babies born now from our embryoscopes, but accept that we still have a lot to learn. So first question posed, what do patients think about time-lapse? Well, there's so much information out there for patients, and I guess when they're starting out on their fertility journey, they don't really know which way to turn. There's a lot of stories about hype, it's not proven. We're telling them, yes, it's proven in our hands, we believe. It's dynamic. There are all these words flying around, and I'm sure they find that quite confusing. So we keep it simple. When we're messaging our patients, when we're giving them information, we keep it relatively simple. These are the key benefits that we talk to them about, that the embryoscope time-lapse gives uninterrupted culture, and they can understand the concept of that. We tell them that we'll get more information from our time-lapse images, and this in turn will give us improved embryo selection. That makes sense. And we also talk to them about improved clinical results, and we show them some of our data. Another benefit we believe is that they can have videos to take home with them, so they like that as well. And the tools that we use to deliver this, the information regarding the benefits are information documentation. We have videos playing in our waiting rooms so they can really understand the dynamic process that is time-lapse. And we've got information on our website, so we try and keep it simple. We have an online patient portal for our time-lapse using patients, so they can log on at the end of the treatment after the embryo transfer. We'll email them a PIN number, and they punch in the PIN number. This is exactly what they see, and they can click to download the videos just of the transferred embryos. So that's what they see. The video link allows the streaming, and they can save it onto their own computer at home. So how we assess what our patients think. So once they've received their video link, we ask them some questions, some electronic feedback, online questionnaire. And this is 6 multiple choice questions, really quick, like SurveyMonkey. And to date, we've had more than 1,000 responses. So I'm going to give you some of that data now. So the questions that we ask, they're themed. We wanted to ask them about the influencing factors. Why? What made them choose time-lapse? What was the trigger for that? Because we try and categorise the benefits to them, which of those benefits really push them towards time-lapse. And we want to know about the quality of the information that we deliver to them. We want to improve, obviously, so we ask questions surrounding the quality of information. We ask them about the video. How do they feel about the video? Was that a key trigger for them choosing time-lapse? And we ask a few questions surrounding their future treatment and thoughts going forward. So the first question, this is 540 responses. So we haven't had the same questions throughout those 3 years. We've changed them. We're on the third change. So we're not changing them every day, but so 540 responses to this question, which was the most influential factor. And most patients said that it was the embryo selection, improved embryo selection. They bought into that, they accept that that makes sense, and that was the main reason they chose to go for the embryoscope. Also, a similar number of patients, not quite as many, said it was the uninterrupted culture. They liked the thought that the embryos are safe, not disturbed for the duration of the culture period. And quite a small number said it was the video that they were interested in, and that's the main reason they went for it. We allow some free text comments as well. So some patients specified that they went for the time-lapse this time because it was their last cycle. They wanted to throw everything at it. They'd had a lot of failures in the past, perhaps, and they would need to try something new. Some said it's novelty, it's something new. We can't get this in every clinic in the UK, so we've come to you for this. And better success rates was specified as a key reason. Now, 85% said they would opt to use embryoscope for future treatment. So I tried to use this one with our financial guys to say, we're going to be inundated, we need to buy more embryoscopes, but it's not really worked. But certainly the vast majority of patients, they're so convinced by it that they say, yes, if we do have to have another treatment, then we want to go for it again. And 82% said that embryoscope improved their understanding of what happens in the lab. And I think that's really important, that your patients feel involved and informed throughout their fertility treatment cycle. And using time-lapse is one way that they really can be more informed than ever before. We can go through the videos with them. The consultants can have iPads in their consulting rooms. They can explain more clearly than ever how embryos develop and how their own embryos developed. And 91% said that the information we provided was clear and aided their decision making. So we were quite pleased with that. So we think we're doing something right. The information is not overcomplicated. We keep the facts clear. So that's quite a good response. So, I mean, a couple of patients strongly disagreed. So we know who they are. We can go and talk to them. What was missing from our information that you would have liked to see? So there is still obviously an opportunity to improve further. And we think it's important, if patients are happy to share their story with other patients. So we asked them in one of the questions, would you be happy to share your story? And 60% said yes. So I thought that's quite a high response rate, and so that's nice. And 91% will view the video straight after downloading. There's a lot of debate within the clinic when we decided to allow the streaming of videos. And my argument was, well, if they download the video, they don't need to watch it there and then. They might want to wait till a pregnancy test. They might even prefer to wait till a baby's born. Or they might never want to see it if it's a failed cycle. So we asked them, at which stage do you intend to, or do you watch the video? And most patients said straight away, straight after downloading. You know, I think I would be the same, but we were interested in that point. So the second part of the talk surrounds what's the real impact of time-lapse for patients. So we've said that there is a superior in vitro incubation environment. I think we accept that as embryologists. We can see if we're not interrupting. We monitor the embryoscope and the conditions don't fluctuate like we're used to in standard incubation. So I think that is a real impact. That's a positive for our patients. The environment is superior. We get more reliable embryo selection. I don't think there's there's much question of that, much more information. And with this information, we can derive embryo selection models. Patients, as I said, get more detailed information, so that's a positive impact for them, and the facility to download their embryos following transfer. Most importantly, I believe they have an improved chance of live birth. It's earlier time to pregnancy, as we've heard in the previous talks, and that's compared with standard methods of incubation and embryo selection. So I'm going to go on just to show you some of our own data, our live birth data, which is not randomised, but the numbers are large. And just to say before that over the last 3 or 4 years, we have derived our own in-house models from our data, from our KID data, which is known implantation data. We've compared the morphokinetics of embryos that have resulted in a positive outcome with those that transferred that have not. And this started right at the beginning with our PGS patients. We compared the morphokinetic profiles of the euploid embryos versus the aneuploid embryos, and we developed simple models based on that, selecting the ones that had the highest chance of being euploid. As we got more data and looked over to our standard patients, we focused on the fetal heart, and we developed models on fetal heart. Now we've got so many babies born, we've derived models based on live birth data. So we're actually on early cleavage model 4 and blast model 4. So 4th generation of our models. And we have different models for IVF and for ICSI because we do see a delay in the IVF timings right through, not just early on. So here you can see a graph showing the standard methods versus the time-lapse in purple for 3 different age categories. And these are live birth per embryo transfer. So this is almost 6,000 ICSI cycles. And we split it out by female age. So under 35, we see an improvement in time-lapse. Similarly with the over 34s, and then the over 39s, a bigger jump in live birth rates per embryo transfer. These uplifts, the relative uplifts, equate to 11% for the under 35s, 22% for the over 34s, and a whopping 59% for the over 39s. So the use of EmbryoScope and the selection models that we've derived for live birth selection now are increasingly effective with advancing maternal age. We're much more active with our deselection. The models are working far harder with our older patients. So this is presumably the reason why we're seeing such big uplifts for the older patients. And I wondered whether it's possible that the older patients' embryos, they're less resilient in the standard incubation with the interruptions that go on. Maybe they're less resilient to the stresses, so they perform better in the EmbryoScope where they're not disturbed. So highly significant differences certainly within the older age categories. So an important question I thought was, can all time-lapse users expect similar differences when they use time-lapse compared to their standard methods? And I think probably not. I think that's going to depend on your baseline practice. If you're phenomenal at embryo culture and embryo selection in your standard, then you'll see one uplift. If your standard incubators are a little bit suboptimal or embryo selection is outdated, then maybe you'll see a more dramatic increase. I don't know, but I think different clinics will, with time-lapse, will certainly be heading in the same direction, but at different rates. And important to say that this model development, it really does require very rigorous and precise annotation, regular review of data, and a lot of attention to detail. So I thought we'd just finish with a short video which I think depicts the wonder of time-lapse and the beauty of our job as embryologists, the impact that we can have on patients. you.